101. Which of the following is a common non-skin-related manifestation of psoriasis? A. Hair loss. B. Joint pain, psoriatic arthritis. C. Difficulty breathing. D. Increased appetite. Answer: joint pain, psoriatic arthritis. Rationale: psoriatic arthritis is a common comorbidity of psoriasis, affecting the joints and leading to pain, swelling, and stiffness. It does not typically cause hair loss, breathing difficulties, or increased appetite. 102. Which of the following should be monitored regularly in patients taking systemic treatments for psoriasis? A. Blood pressure. B. Liver function. C. Bone density. D. Hair follicle count. Answer: liver function. Rationale: systemic treatments like methotrexate and cyclosporin can affect liver function, so it is important to monitor liver enzymes regularly. Blood pressure, bone density, and hair follicle count are not as closely linked to psoriasis treatments. 103. Which of the following is a common risk factor for developing psoriasis? A. Smoking. B. Hypertension. C. Low-fat diet. D. Regular exercise. Answer: smoking. Rationale: smoking is a known risk factor for developing psoriasis and can worsen the condition. Hypertension, low-fat diet, and regular exercise are not major risk factors. 104. Which of the following is a major characteristic of pustular psoriasis? A. Silvery scaling plaques. B. Pus-filled blisters on red skin. C. Thickening of the skin. D. Red spots in the folds of the skin. Answer: pus-filled blisters on red skin. Rationale: pustular psoriasis is characterized by the presence of pustules or pus-filled blisters on inflamed skin. Other forms of psoriasis, such as plaque psoriasis, may show silvery scales or thickened skin. 105. Which of the following therapies is commonly used to treat moderate to severe psoriasis in patients who do not respond to topical treatments? A. Antihistamines. B. Oral corticosteroids. C. Biologic therapies. D. Antibiotics. Answer: biologic therapies. Rationale: biologic therapies are commonly used for moderate to severe psoriasis that does not respond to topical treatments. Oral corticosteroids are used in some cases, but not as a long-term treatment for psoriasis. Antihistamines and antibiotics are not used for psoriasis management. 106. What is the most common age of onset for psoriasis? A. Childhood. B. Adolescence or early adulthood. C. Middle adulthood. D. Older adulthood. Answer: adolescence or early adulthood. Rationale: psoriasis most commonly presents between the ages of 15 and 35. It can also develop later in life, but the majority of cases begin in adolescence or early adulthood. 107. Which of the following is the primary goal in the treatment of psoriasis? A. Preventing infection. B. Reducing skin cell turnover. C. Increasing hydration of the skin. D. Boosting the immune system. Answer: reducing skin cell turnover. Rationale: the primary goal in treating psoriasis is to slow the rapid turnover of skin cells and reduce inflammation, which leads to the characteristic plaques. Other goals include reducing symptoms and improving quality of life. 108. Which of the following is a key feature of inverse psoriasis? A. Thick, scaly plaques. B. Pustules surrounded by red skin. C. Smooth, red patches in skin folds. D. Loss of skin color. Answer: smooth, red patches in skin folds. Rationale: inverse psoriasis appears in skin folds, e.g., underarms, groin, as smooth, red patches with little to no scaling. Thick, scaly plaques are more typical of plaque psoriasis. 109. Which of the following is considered a first-line treatment for scalp psoriasis? A. Oral corticosteroids. B. Phototherapy. C. Topical corticosteroids. D. Methotrexate. Answer: topical corticosteroids. Rationale: topical corticosteroids are the most common and effective first-line treatment for scalp psoriasis. Oral corticosteroids and methotrexate are typically reserved for more severe cases, and phototherapy is used for widespread psoriasis. 110. Which of the following is a common side effect of topical corticosteroids in the treatment of psoriasis? A. Hypertension. B. Skin thinning. C. Nail discoloration. D. Weight gain. Answer: skin thinning. Rationale: long-term use of topical corticosteroids can lead to skin thinning, which is a common side effect. Hypertension, nail discoloration, and weight gain are more commonly associated with systemic steroids. 111. What is the role of phototherapy in the treatment of psoriasis? A. To reduce inflammation and slow skin cell turnover. B. To increase the rate of skin cell turnover. C. To fight bacterial infections. D. To moisturize the skin. Answer: to reduce inflammation and slow skin cell turnover. Rationale: phototherapy, specifically UVB, is used to treat psoriasis by slowing skin cell turnover and reducing inflammation. It does not increase cell turnover or moisturize the skin. 112. Which of the following is the most effective long-term treatment option for severe, resistant psoriasis? A. Topical corticosteroids. B. Biologic agents. C. Methotrexate. D. Oral antihistamines. Answer: biologic agents. Rationale: biologic agents are highly effective for treating severe or resistant psoriasis. They target specific parts of the immune system to reduce inflammation and skin cell turnover. Methotrexate is also used, but is typically not as effective for long-term management in severe cases. 113. Which of the following triggers can worsen psoriasis? A. Stress. B. Regular exercise. C. Sun exposure. D. High-fiber diet. Answer: stress. Rationale: stress is a well-known trigger for psoriasis flare-ups, as it can lead to inflammation. Sun exposure can help some patients, but excessive exposure can worsen psoriasis. Regular exercise and a high-fiber diet do not typically worsen psoriasis. 114. What is a hallmark sign of guttate psoriasis? A. Large, raised plaques with silvery scales. B. Small, drop-like lesions. C. Pus-filled blisters. D. Smooth, red patches in skin folds. Answer: small, drop-like lesions. Rationale: guttate psoriasis is characterized by small, drop-shaped lesions that often appear suddenly, usually after a streptococcal throat infection. 115. What is the most common comorbidity in patients with severe psoriasis? A. Depression. B. Asthma. C. Rheumatoid arthritis. D. Stroke. Answer: depression. Rationale: depression is a common comorbidity in patients with severe psoriasis due to the psychological impact of the condition. Psoriatic arthritis is also common, but depression is the most prevalent. 116. Which of the following is a risk factor for developing psoriatic arthritis? A. Obesity. B. High cholesterol. C. Family history of psoriasis. D. High blood pressure. Answer: family history of psoriasis. Rationale: a family history of psoriasis is a major risk factor for developing psoriatic arthritis, which affects about 30% of people with psoriasis. Obesity, high cholesterol, and high blood pressure are risk factors for other conditions, but not specifically for psoriatic arthritis. 117. Which of the following is the most likely treatment for severe, generalized psoriasis flare-ups? A. Oral corticosteroids. B. Biologic therapy. C. Antihistamines. D. Vitamin D analogs. Answer: biologic therapy. Rationale: biologic therapies are used for severe, generalized psoriasis that does not respond to topical treatments. Oral corticosteroids may provide temporary relief, but are not ideal for long-term management. 118. Which of the following is a common complication of untreated psoriasis? A. Psoriatic arthritis. B. Vision loss. C. Liver failure. D. Kidney stones. Answer: psoriatic arthritis. Rationale: untreated psoriasis can lead to psoriatic arthritis, which affects the joints and causes pain and swelling. Vision loss, liver failure, and kidney stones are not direct complications of psoriasis. 119. What is the primary mechanism of action of biologic drugs in the treatment of psoriasis? A. Inhibiting T-cell activation. B. Stimulating skin cell growth. C. Suppressing the production of sweat. D. Enhancing immune system function. Answer. Inhibiting T-cell activation. Rationale. Biologics work by targeting specific parts of the immune system, such as inhibiting T-cell activation, which reduces inflammation and skin cell turnover. 120. What is the key difference between psoriasis and eczema? A. Psoriasis is more common in infants. B. Psoriasis causes more itching. C. Eczema tends to have a more chronic course. D. Psoriasis has well-defined plaques with scales. Answer. Psoriasis has well-defined plaques with scales. Rationale. Psoriasis is typically characterized by well-defined, scaly plaques, while eczema often presents as red, itchy patches with less distinct borders. Eczema is also more common in children, and both conditions can cause itching. 121. Which of the following factors is most commonly associated with the onset of psoriasis? A. Infection. B. Trauma or injury to the skin. C. Exposure to cold weather. D. Low iron levels. Answer. Trauma or injury to the skin. Rationale. Psoriasis can be triggered by trauma or injury to the skin, a phenomenon known as the Koebner phenomenon. Infection can also trigger psoriasis in some individuals, but trauma is the most common. 122. Which of the following is a typical treatment approach for localized psoriasis? A. Oral corticosteroids. B. Topical corticosteroids. C. Methotrexate. D. Biologic agents. Answer. Topical corticosteroids. Rationale. For localized psoriasis, topical corticosteroids are the first-line treatment. Oral corticosteroids and biologic agents are typically reserved for more severe, widespread psoriasis. 123. Which of the following is a common side effect of methotrexate, a systemic treatment for psoriasis? A. Weight loss. B. Nausea and vomiting. C. Joint pain. D. Vision problems. Answer. Nausea and vomiting. Rationale. Nausea and vomiting are common side effects of methotrexate, along with liver toxicity and blood disorders. Joint pain is associated with psoriatic arthritis, but not a direct side effect of methotrexate. 124. What is the role of vitamin D analogs in the treatment of psoriasis? A. To reduce inflammation and scale formation. B. To increase skin cell turnover. C. To treat bacterial infections. D. To reduce itching. Answer. To reduce inflammation and scale formation. Rationale. Vitamin D analogs are used topically to reduce inflammation, scale formation, and skin cell turnover in psoriasis. They do not treat bacterial infections or specifically reduce itching. 125. Which of the following factors can contribute to the development of nail psoriasis? A. Poor hygiene. B. Trauma or injury to the nails. C. Use of acrylic nails. D. Smoking. Answer. Trauma or injury to the nails. Rationale. Trauma or injury to the nails can trigger the development of nail psoriasis in individuals who are predisposed to the condition. Poor hygiene and smoking do not directly cause nail psoriasis, but smoking can worsen psoriasis. 126. What type of psoriasis is most likely to affect the palms and soles? A. Inverse psoriasis. B. Guttate psoriasis. C. Pustular psoriasis. D. Erythrodermic psoriasis. Answer. Pustular psoriasis. Rationale. Pustular psoriasis can affect the palms and soles and is characterized by pustules on red, inflamed skin. Other forms of psoriasis may occur on other areas of the body, but not typically in these locations. 127. Which of the following is an essential aspect of managing psoriasis long-term? A. Regular moisturization. B. Strict low-fat diet. C. Avoiding all sunlight. D. Consistent use of oral steroids. Answer. Regular moisturization. Rationale. Regular moisturization helps to prevent dryness and irritation associated with psoriasis. Avoiding all sunlight and following a strict low-fat diet are not necessary, and oral steroids are not recommended for long-term use. 128. Which of the following treatment options may be helpful for a patient with severe psoriasis who has not responded to other therapies? A. Methotrexate. B. Topical corticosteroids. C. Biologic therapy. D. Oral antihistamines. Answer: biologic therapy. Rationale: biologic therapies are used for severe, treatment-resistant psoriasis. Methotrexate can also be used, but biologics are often more effective for long-term management of severe cases. Topical corticosteroids and antihistamines are not suitable for severe cases. 129. What is the primary goal of psoriasis treatment? A. To completely cure the disease. B. To reduce inflammation and prevent flare-ups. C. To speed up the healing process. D. To prevent secondary infections. Answer: to reduce inflammation and prevent flare-ups. Rationale: the primary goal of psoriasis treatment is to reduce inflammation, control symptoms, and prevent flare-ups. While psoriasis is a chronic condition, a cure is not typically possible. 130. What lifestyle modification can help manage psoriasis symptoms? A. Quitting smoking. B. Eating more processed foods. C. Reducing physical activity. D. Increasing alcohol consumption. Answer: quitting smoking. Rationale: quitting smoking can help reduce the severity of psoriasis. A healthy lifestyle, including regular physical activity and a balanced diet, can also help manage symptoms. 131. What is the primary mode of transmission for the hepatitis C virus, HCV? A. Oral ingestion. B. Blood-to-blood contact. C. Airborne transmission. D. Sexual contact. Answer: blood-to-blood contact. Rationale: HCV is primarily transmitted through blood-to-blood contact, often from sharing needles or other equipment for drug injection. It is not transmitted via oral ingestion, airborne contact, or sexual contact, although the latter is possible but less common. 132. Which of the following is the most common symptom of hepatitis C infection? A. Jaundice. B. Nausea. C. Fatigue. D. Coughing. Answer: fatigue. Rationale: fatigue is the most common symptom of hepatitis C and often persists for long periods. Jaundice can occur in severe cases, but is not as common. Nausea and coughing are not specific to hepatitis C infection. 133. Which of the following is used to diagnose hepatitis C? A. Chest X-ray. B. Liver biopsy. C. Blood tests for antibodies and viral RNA. D. Urine culture. Answer: blood tests for antibodies and viral RNA. Rationale: the diagnosis of hepatitis C is primarily made through blood tests that detect antibodies to the virus and the presence of viral RNA. Liver biopsy can be used to assess liver damage, but is not the first step in diagnosis. 134. What is the first-line treatment for hepatitis C? A. Interferon therapy. B. Antiviral medications, direct-acting antivirals. C. Liver transplant. D. Chemoembolization. Answer: antiviral medications, direct-acting antivirals. Rationale: direct-acting antivirals, DAs, are the first-line treatment for hepatitis C and have revolutionized treatment by providing high cure rates with fewer side effects. Interferon therapy is an older option, and liver transplant is a solution for end-stage liver disease, not initial treatment. 135. Which of the following is a major risk factor for hepatitis C? A. Drinking alcohol excessively. B. Receiving blood transfusions before 1992. C. Having unprotected sex. D. Being overweight. Answer: receiving blood transfusions before 1992. Rationale: hepatitis C was commonly transmitted through blood transfusions before the implementation of blood screening in 1992. Alcohol abuse can worsen liver damage, but it is not a primary risk factor for acquiring the infection. 136. Which of the following is a complication of chronic hepatitis C infection? A. Asthma. B. Cirrhosis. C. Diabetes. D. Osteoporosis. Answer: cirrhosis. Rationale: chronic hepatitis C can lead to cirrhosis, which is severe scarring of the liver tissue. Asthma, diabetes, and osteoporosis are not directly caused by hepatitis C, though comorbidities may exist. 137. Which of the following is the primary function of the liver? A. Producing insulin. B. Storing vitamins. C. Filtering toxins from the blood. D. Producing red blood cells. Answer: filtering toxins from the blood. Rationale: the liver's primary function is detoxifying the blood by filtering out toxins and waste products. It also plays a role in storing vitamins and producing proteins, but its most critical role is detoxification. 138. Which of the following is not a sign of acute liver failure? A. Jaundice. B. Abdominal pain. C. Bleeding tendencies. D. Elevated blood pressure. Answer: elevated blood pressure. Rationale: acute liver failure is characterized by jaundice, abdominal pain, and bleeding tendencies due to impaired clotting factor production. Elevated blood pressure is not typically a sign of acute liver failure. 139. Which of the following tests is used to monitor liver function? A. Complete blood count, CBC. B. Liver function tests, LFTs. C. Electrocardiogram, ECG. D. Urinalysis. Answer: liver function tests, LFTs. Rationale: liver function tests, LFTs, are specifically designed to assess the liver's ability to process proteins and filter toxins. A CBC can assess overall health, but it is not specific to liver function. An ECG and urinalysis are unrelated to liver function. 140. Which of the following is true about the hepatitis B virus, HBV? A. It is transmitted only through sexual contact. B. It can be prevented with a vaccine. C. It only affects adults. D. It does not cause long-term liver damage. Answer: it can be prevented with a vaccine. Rationale: hepatitis B can be prevented with a vaccine and is transmitted through blood, sexual contact, and from mother to child during childbirth. It can affect people of all ages and may lead to long-term liver damage if chronic. 141. What is the primary treatment for hepatitis B? A. Antiviral medications such as tenofovir. B. Interferon therapy. C. Antifungal drugs. D. Surgery. Answer: antiviral medications such as tenofovir. Rationale: antiviral medications like tenofovir are the primary treatment for chronic hepatitis B infection. Interferon can be used in some cases, but it is not the first-line treatment. Antifungal drugs and surgery are not appropriate for treating hepatitis B. 142. What is a common symptom of early-stage cirrhosis? A. Severe headache. B. Abdominal swelling. C. Chronic cough. D. Sudden weight loss. Answer: abdominal swelling. Rationale: early-stage cirrhosis can cause abdominal swelling, ascites, due to fluid buildup. Severe headache and chronic cough are not symptoms of cirrhosis. Sudden weight loss may occur in later stages of liver disease, but it is not a primary early symptom. 143. What is the role of the hepatitis B surface antigen, HBsAg, in diagnosing hepatitis B? A. It indicates a past infection with hepatitis B. B. It indicates an active infection with hepatitis B. C. It indicates immunity to hepatitis B. D. It indicates a genetic predisposition to hepatitis B. Answer: it indicates an active infection with hepatitis B. Rationale: the presence of HBsAg indicates an active hepatitis B infection. It does not indicate past infection or immunity. Specific antibodies and other markers are used to assess past infection and immunity. 144. What is the goal of treatment for chronic hepatitis B? A. To cure the infection. B. To reduce viral replication and prevent liver damage. C. To eradicate the virus from the body. D. To eliminate symptoms without affecting the virus. Answer: to reduce viral replication and prevent liver damage. Rationale: the primary goal of treatment for chronic hepatitis B is to reduce viral replication and prevent liver damage, as complete eradication is not always possible. The focus is on controlling the infection and preventing complications. 145. What is a potential long-term complication of chronic hepatitis B infection? A. Asthma. B. Liver cirrhosis. C. Lung cancer. D. Rheumatoid arthritis. Answer: liver cirrhosis. Rationale: chronic hepatitis B can lead to liver cirrhosis, a condition where healthy liver tissue is replaced by scar tissue, impairing liver function. Asthma, lung cancer, and rheumatoid arthritis are not direct complications of hepatitis B. 146. Which of the following is a characteristic of non-alcoholic fatty liver disease, NEFLD? A. Liver inflammation caused by alcohol consumption. B. Excess fat in the liver without alcohol consumption. C. A viral infection of the liver. D. A genetic disorder leading to liver dysfunction. Answer: excess fat in the liver without alcohol consumption. Rationale: NEFLD is characterized by the accumulation of fat in the liver without alcohol consumption. It is distinct from alcoholic fatty liver disease and is often associated with obesity and metabolic syndrome. 147. What is the best method for preventing liver disease due to hepatitis C? A. Vaccination. B. Safe blood transfusions. C. Alcohol moderation. D. Weight loss. Answer: safe blood transfusions. Rationale: hepatitis C transmission can be prevented through safe blood transfusions, as the virus is primarily spread through blood-to-blood contact. There is currently no vaccine for hepatitis C, and alcohol moderation and weight loss are more focused on managing liver health rather than preventing the infection. 148. Which of the following is a common side effect of interferon therapy for hepatitis B and C? A. Weight gain. B. Flu-like symptoms. C. Severe headaches. D. Increased appetite. Answer: flu-like symptoms. Rationale: interferon therapy can cause flu-like symptoms, including fever, chills, fatigue, and muscle aches. Weight gain, severe headaches, and increased appetite are not typical side effects of interferon therapy. 149. Which of the following is a primary risk factor for developing non-alcoholic fatty liver disease, NEFLD? A. Excessive alcohol consumption. B. Obesity. C. High iron levels. D. Vitamin D deficiency. Answer: obesity. Rationale: obesity is the primary risk factor for NEFLD, as excess body fat can lead to fat accumulation in the liver. Alcohol consumption is a factor in alcoholic fatty liver disease, not NEFLD. High iron levels and vitamin D deficiency are not primary risk factors for NEFLD. 150. Which of the following is a key indicator of liver failure? A. Increased cholesterol levels. B. Decreased liver enzymes. C. Reduced clotting factor production. D. Increased blood pressure. Answer: reduced clotting factor production. Rationale: liver failure can result in reduced production of clotting factors, leading to bleeding tendencies. Increased cholesterol levels, decreased liver enzymes, and increased blood pressure are not direct indicators of liver failure.